I am speaking the most widely spoken language in the world, broken English. I'm a first-generation immigrant from South Korea. Learning a different language and culture was definitely a challenge. When my daughter was invited to the preschool birthday party, I spotted the yummy birthday cake. I wanted it badly, so I waited for the right moment. Finally, the host asked me, "Would you like to have a piece of cake?" I say, "No, I'm okay." In my culture, you are not supposed to say yes right away. First say no, then someone will insist. Then you can say, okay, if you insist. But this host never asked me again. So I quickly learned I will never say no when Americans offer the food. When my daughter went to the first grade, I started ESL at the age of 30. After that, I started taking several classes in community college. The first day of the class, the professor started to talk about Adam. I know the story of Adam and Eve from creation in the Bible. It was odd because professors do not normally talk about religion in the class. Oh, well, he might be a Christian, tried to bring some perspectives. A few days later, I received my biology textbook. First chapter was talking about atoms, A-T-O-M-S. It is still a miracle. I graduated with the biology honors and got into dental school at age of 40. While I was in dental school, I needed braces due to the overcrowding and misalignment of my teeth. Since my small jaw did not have enough space for all my teeth, several teeth were removed, just as any conventional dentist would have done. Few years later, I suddenly started having a dry cough that continued for over a year. I saw doctors and specialists, and my medication list got longer. Symptoms got worse. Every cough was so painful. Once, in the middle of the night, I could not breathe and went to ER. They did a lot of tests throughout the night. ER doctor said to me, "By the way, one of your ribs was broken." I had coughed so hard, I had broken a rib. With another referral, I was diagnosed with cough variant asthma. I was prescribed more medications. However, I started to have an upper respiratory tract infection every 2 months. Another rounds of steroid and antibiotics. I also developed allergies and skin rashes. I finally said, that's it. I decided to look for alternatives. I already have a relatively healthy lifestyle, but I practice even more healthier diet and exercise. My favorite exercise is hot yoga. One day, my yoga teacher recommended a book called Breath by James Nestor. I learned to connect the dots from underdeveloped jaws and obstructive airways to various human diseases like asthma, COPD, high blood pressure, hormonal imbalance, mental illness, and even cancer. Most modern people have underdeveloped jaw due to a modernized soft diet, pollution, lack of breastfeeding, mouth breathing, incorrect tongue position while resting and swallowing. An underdeveloped jaw means there's not enough space for teeth and tongue. Simply put, you have a big car in a small garage. That was what exactly I went through with my small jaw to develop asthma and other symptoms, because my orthodontic treatment made my jaw even smaller. The author did a lot of experiments himself, including developing jaw treatment with Dr. Theodore Balfour. I reached out to him and was privileged to train with him up to the most advanced level. Unfortunately, he passed away, so I was in the last group of dentists he trained. Through this training, I acquired a new perspective on teeth. The teeth are the most diverse organ in the human body, morphologically and functionally. As a dentist, I learn about the teeth in detail at the microscopic level. However, I did not learn how they fit into the cranial system. In other words, I was trained to create the pretty door, to consider shape and color and how to restore them when they're damaged. However, we never talk about door frame. Let me talk about the door frame, which is the skull. There are 22 bones and 12 pairs of cranial nerves. Look at the teeth and how they are embedded in upper and lower jaws. This whole craniofacial system is beautiful and brilliant if it works together harmoniously. What's inside of this system? The most important organ, the brain. When our skull has a right form, our brain will function properly. Conversely, when our skull does not have the right form, it can have a negative effect on brain function. Let me focus on the nerves around the teeth. Cranial nerve 5, called trigeminal nerve, is the largest nerve in human. Every tooth and surrounding ligament, called PDL, periodontal ligaments, are richly supplied with sensory and autonomic nerve fibers. Look at the proximity of these nerves to the brain. Many of you may have experienced the toothache as the worst pain in the world, right? One bad tooth makes whole face hurt. Most of you also can tell the texture of your favorite steak in one bite. Juicy and tender, or hard and rubbery. That's why teeth are considered a sensory organ. Your teeth has the ability to perceive immense amount of information. Every jaw movement is monitored by this sensory feedback mechanism. Now, look at the position of the teeth in the skull again. The teeth are supporting whole craniofacial system. All 32 teeth are supposed to be in the system by design. When you lose one tooth, even though you may not notice, the system loses balance. The most important function of the teeth is not chewing, talking, or smiling. The most important function of the teeth is supporting craniofacial structure, so your brain can function properly. However, most people have some degree of cranial distortion. It starts from mother's womb, birth canal, delivery, and many traumatic events in life. This leads to different ways of adaptation, including malocclusion or crooked teeth. If you have a crooked teeth, you probably have a crooked face. Your dental occlusion is the adaptive result of your cranial pattern. So before aligning the teeth, it is vital to align the skull. Before making a pretty door, we have to make a stable door frame. If not, every time you close the door, some part of the door will be banging. Let's have a bigger picture. Just as a door frame has to be aligned with the building. Our skull has to be aligned with the body. In our body, it is essential to have a functional alignment of the head, shoulder, hips, and knees and toe. In the head, eyes and ears and teeth all need to be aligned. Then every movement is easy and efficient. When one part of the body is misaligned, the rest of the body must compensate for it. One common body compensation is head forward position. Dr. Roger Sperry, who won the Nobel Prize in brain research, says, better than 90% of brain's output is directly toward maintaining your body in its gravitational field. Therefore, the less energy one spends on one's posture, the more energy is available for healing, digestion, and thinking. So, crooked teeth represent craniofacial structure, which means crooked body. Okay, what do we do with the crooked body, crooked face, and crooked teeth, and all of the above? Fortunately, there are various ways to improve them. We need a collaborative approach to treat the whole system. That's why I work with chiropractor, nutritionist, myofunctional therapist, sleep physician, and even more. As a dentist, we can reverse engineer the function of the teeth to develop the face in a symmetrical way and grow underdeveloped jaw without surgery. Yes, we can grow bones at any age if we provide the correct guidance. If you have all 32 teeth in harmony, congratulations, you are a superhuman. I've seen several thousand patients in my career. I rarely see those. Now, when you look at your teeth in the mirror, appreciate them. Take care of them even more. The most important function of the teeth is not chewing, talking, or smiling. The most important function of the teeth is to develop and support craniofacial system so your brain can function properly. I hope you have a new perspective on your teeth. I want you to keep all of your teeth in your mouth, all of them, for the rest of your life. If you have a broken, chipped, or cracked tooth, please restore them in the most conservative and long-lasting way possible. Even if severely damaged tooth has a way to be saved, please save it instead of removing it. Your teeth are so much more valuable than the price tag of the dental treatment. If you or your child need braces and was told to remove several teeth due to overcrowding, I hope you find a treatment to develop your jaw so you can preserve your teeth. Consider dental visit as a whole body treatment. If you have an airway or sleep concern, I hope you find a dentist who can construct your airways and improve your sleep. If you have some disease, doesn't seem to have a solution except take medications, I hope you consider a dentist visit to find a natural solution. Your teeth are the gateway to your overall well-being. It is literally right under your nose. Early modern Spanish writer Miguel de Cervantes said, "Every tooth in man's head is more valuable than a diamond."